Working as a consultant with the mental health and home treatment team, my day involves quite a lot of flexible working. We tend to be more mobile and see patients at home because often the patients are very unwell.
The community staff had told us that they wanted to have more efficient ways of working. They were wasting a lot of the time travelling across the city to go back to the work base and enter up the details onto the Amagos system. It was obvious that to gain some efficiencies, we needed to look at mobile working.
Everything was on computer system and has been for a very long time, but the difficulty with that is that if you're working mainly in the community and not in one of the offices, you don't have any access to those notes or those systems.
At the end of the day, we'd have to go back to the office, try and find a computer and write your notes up.
So it may be that if you go and see a patient at home, if you don't know the patient, you'd have to print off a lot of the information before you went, which was obviously a bit of a pain carrying it around. Also not great for patient confidentiality because you're carrying around unanonymised notes. If you were on call, you wouldn't necessarily have time to come back and print out any information or look at the patient's notes, which obviously made the assessments difficult to do and possibly not the best clinical care that we could provide.
One of the benefits of actually having the electronic record in your hand is that you know that it's accurate and it's in real time, as opposed to shorthand notes that might be out of date or slightly inaccurate. As an NHS trust, obviously security is vital in terms of protecting the confidentiality of our service users' details. The fact that the NDL mobile working toolkit offers 256-bit encryption assured us that the data would be safe.
It's far more secure than carrying around paper notes. If, for example, your car got broken into, you lost your tablets, then all we'd need to do is contact the IT department and the tablet would be wiped.
One of the benefits is the fact that it allows offline working. There are areas of the city where there is no signal, so it's very important that we're able to download the data and still be able to work and see the details on the system.
It's really useful to have the tablet now because you can come out of a patient's house and immediately write up your notes straight onto Amagos Lite.
I can find people's addresses, contact details if they're not in. I can phone them from the number on the Amagos system. I can look at the entries people have made, which makes it a lot easier for me to make a decision.
So our community staff feel more empowered now because they've got information at their fingertips that allows them to actually either spend more time with the service users or visit more service users in the day. So with our solution, what we've got is over 250 users accessing service user data on tablets around Manchester. This obviously goes to show the scalability and stability of NDL's offering. Another benefit of NDL's toolkit is it'll work on practically any mobile device. You can see when you're in the integrated development environment that you can deploy it to basically every type of device that's available on the market. The training NDL provided has been first class. It allowed us to get up and running very early on in the project and be able to build something quite quickly. We're really impressed with the level of support that we get. They react very quickly anytime that we've got any problems and make sure that they maintain the contact with us until a resolution is found. For other trusts, I would recommend getting your users involved as early as possible in the project. This way it will ensure that what you're delivering actually meets the requirements of the users.
One of the other benefits that I found with the app is that it's continually changing, it's continually improving. It gives me the information to make an informed decision.